Hello everyone, I'm Dr. Ushna Naveed. I'm FCPS dermatologist and AMC 1 clear. If you're looking for the AMC exam preparation and if you are wondering that what are the resources, what are the strategies you should look for, then this video is perfectly for you. In this video, I'm going to cover how you're going to approach the AMC, what the AMC actually demands from you as an exam, and what you should focus when you are preparing for the exam, like which topics are important, which are the high yield topics, and how you are going to ace the exam. Remember, AMC is not about memorizing the books. It's about understanding the concepts and applying the clinical reasoning in the Australian medical practice. That's why if you stay focused rather than just reading the books again and again, that is going to help to clear the exam. This is my channel for the Telegram and the WhatsApp link. You can join the link and just go through the all the guidelines that I have uploaded in the Telegram group that are exactly free of cost. Okay, so this is very important for you to be focused for your preparation. First of all, the frequently asked questions, that what are the important resources of the AMC. Remember, many a times it is said nowadays that AMC handbook is outdated. No doubt this is outdated, but remember, when you are preparing for AMC, the most important book still recommended is the AMC handbook of multiple choice questions that give you the exact question topics. Topics are more important as compared to the MCQs. So that give you insight that these topics are the favorite topics of AMC and these topics you cannot miss for your exam. So I would recommend must go through this book as well. Then your John Murtagh as a reference book of textbook, Australian Therapeutic Guidelines. We will discuss that what are the Australian Therapeutic Guidelines and this Therapeutic Guidelines TG if you have subscription. This is the paid subscription. TG is not available free of cost. But as I said earlier, there are many groups that keep on uploading the files of the TG and even the updated one. If you join the Telegram group of AMC Smart Prep, then you can find all the therapeutic guidelines related topics and files that are updated in 2025 and 2026 in that group. Then last one is your AMC recalls, extremely important. For AMC recalls, it's not just memorizing the stem or whatever the question is about. It's about the topic. Okay, whatever the question that is coming in the exam, you have to go through each and every aspect of that topic. AMC can give a very minor change in exam and the answer is going to be changed. So eMedici is the recommended pool by the AMC itself, so extremely important. These are the different sources you should remember: therapeutic guidelines, handbook of multiple choice questions, eMedici, John Murtagh, and Kaplan's for psychiatry. Sometime people use this as well. Then there are different guidelines that are available free of cost. You can just search on the Google, like RACGP for every medical topic. Then you have essay health topic, extremely important and concise guideline for your gynae topics. Okay, all the gynae and ops related topics are beautifully given in the essay health. If you just go through the guidelines, there are some tips and tricks to read the guidelines as well. You do not need to remember guidelines word to word, or you do not need to go through the guidelines again and again word to word. Just the flowcharts are extremely important when you go through any guideline. Okay, so essay health is the life saving for the gynecology and obstetrician. Then you have RCH guideline. You can easily write any topic related to peds, let's say group. Okay, you have to write group RCH on the Google, and you this guidelines is going to be opened. Okay, group RCH, epiglottitis RCH, pneumonia, UTI, any topic. So peds related all the topics you can find on RCH just directly free of cost on the Google. Then you have ortho related topics that are very concisely given in the ortho bullets. But again, I would say you have to correlate all the important knowledge, whatever you are finding in the guidelines, with the recalls, with the eMedici pools. Okay, because if you are reading the topic, you are blank. You will just gather the chunks of information that okay, this is the information that is required, this is the topic is all about, but at the end you will be blank because the course is so vast. But if you do the recall give you insight that among the topic, which are the key points you need to focus upon, what the AMC loves to ask. So go through the recalls side by side. Do not put the recalls at the end of your months or after going through the theory. Do the recalls side by side. Do the MCQ practice side by side. This is the most important thing when you are preparing for your exam. Then the emergency related topics that are very good in the life in the fast lane. There is a drawback that surgery related concise guidelines are not there in any of the updated pool of the e-medicine. You have to gather the information of surgery related topics from different guidelines, different sources. Apart from these guidelines, which are very basic guidelines, you can use Queensland, okay, Queensland guidelines, or you can use Victoria guidelines sometime, or sometime Western Australia. So some topic you will find in these guidelines as well. So these are very important guidelines you should know about your AMC. This book is a lifesaver book. This is your preventive activities in a general practice, that we mostly called it as red book. Okay, so red book, this is again available on the Google free of cost. You can just go through the red book regarding all your screening topics. Today we are not going into detail that which screening topics are important. I will make the video for the important screening topics as well, because the screening is a very important high yield scoring topic of your AMC. So these are the guidelines and these are the book resources that you should go through for preparation of your AMC exam. This is the format. Many a times we just start the preparation so blank that we are not even aware that what is the format of AMC. So AMC has basically 150 MCQs, that is 3.5 hour session, and there is no, you cannot skip the topic. Okay, you have to go through all the MCQ in a single session. There's no negative marking, so if even you are not sure, just click any answer and go to the next. That is going to save time, because if any topic is not clicking and you do not have the background knowledge, that is going to waste your time. So just click any random option and go to the next one. Okay, so this is very important. You cannot skip any question. 150 are the total MCQs. To pass in the exam, you need 250 scoring. Okay, just have a clear concept that the AMC scoring is a percentile scoring. This is not something that among the 500 MCQ, you if you just click half answers right, then you are very sure to get the 250 scores. That is not the case. Maybe if you are attempting 100 MCQ and the other candidate is also attempting 100 MCQs and you're both have 100 MCQ right, but this MCQ have a low weightage and this MCQ has a high weightage, then very high chance that this candidate is going to succeed and this candidate maybe not. But this is a very in-depth analysis. You do not need to go into the so much detail that which MCQ is higher one, which MCQ is the lower one. Just make your preparation so clear that you need to score 250. Okay, that is required. Actual score of 250, that is required. Now we have a clear demarcation that which subjects are extremely important for your exam. So if you're preparing for AMC, you should focus on the high yield subjects like medicine, that is 35 MCQs, and your surgery 25 MCQs. Your women health 15, child health is 15, mental health, that means your psychiatry, that your public health, that is 15, and last one is population health and screening. By population health, it includes many topics. It includes screening, it includes your indigenous health, vaccination, toxicology, many topics. So these are the distribution roughly. So we have different MCQs, and this is again the weightage of the MCQ. Like 30% is just your medicine. So if your medicine is too good, that there is a possibility that if you do not score too good in any other domain, let's say public health or psychiatry, this medicine will compensate that domain as well. Okay, I have seen many candidates who score below the required borderline scoring. Like let's say this candidate did not score well in the population health, did not score well in the mental health, and the other categories were maybe beyond good or maybe just a borderline, but overall cumulative you need 250 scoring. So sometimes your one category can compensate the other as well. So while preparing the exam, you cannot skip any category. You need to focus on the major categories like medicine and surgery, but you cannot skip any category. Okay, so any all the categories are equally important. Any category can compensate the other one. You never know that. Then the very important question that I have encountered many times, that what are the high yield topics for the AMC? Remember, the AMC has a very good pool of topics that you go through the recalls, then you will make the list that these are the topics which AMC loves to ask, which are repeatedly coming in the exam. So you should be master of these topics. In the emergency acute care, you have very common topic of ACLS, BLS, shock, anaphylaxis, sepsis, then your trauma, burns, poisoning. In poisoning, they love to ask about the paracetamol poisoning, carbon monoxide poisoning, opioid poisoning. These are very favorite topics of AMC. Then acute abdomen, electrolyte emergencies, and acid-base disorders. I would again say that AMC do not like to ask about pathogenesis, pathophysiology. So do not get trapped by the courses that are running for the very long concepts of giving pathogenesis, why the electrolyte is entering into the body, why this molecule is forming in the body. That is not required for your AMC. AMC just focused on the diagnosis, initial management, next strategy, best approach. They are basically analyzing you. Are you a safe doctor? Are you able to practice in a clinical setting? That is required for your exam. In acute presentation, you have chest pain, shortness of breath, syncope, headache, red flags, extremely important, fever, confusion, collapse, and acute urinary retention. These are some emergency related topic. Then we have cardiology domain. Cardiology, we have different domains like ischemic heart disease, angina, ACS. You need ECG interpretation as a basic level as well. Then cardiac biomarkers, post-MI complication, arrhythmia, AFib, SVT, VT, bradyarrhythmia, heart blocks. Okay, so these are very important high yield topics. Heart failure, valvular diseases, hypertension. In hypertension, do not focus on the primary hypertension just. You need to remember the hypertensive emergency. You need to know the secondary causes like pheochromocytoma, very important cause of secondary hypertension. Your Cushing disease, Cohn's disease, these are very important cause of your secondary hypertension as well. So focus on these as well. Then you have respiratory medications. Okay, so respiratory medicine, you have asthma, COPD. Then you have infectious diseases. They love to ask about asthma, so go through the asthma, each and every concept of asthma, exercise induced, new updates, management, everything is important. Then you have pulmonary embolism and pneumothorax, very favorite topic of AMC. They love to ask about the pneumothorax. Then lung cancer, sleep apnea, and ILD. Gastroenterology, you have GERD, peptic ulcer, bleeding. Then hepatology, you have hepatitis, cirrhosis, portal hypertension, ascites, and hepatic encephalopathy. Then lower respiratory, you have IBD, irritable bowel disease. One is IBD, one is IBS. Colorectal cancer, and the screening of colorectal cancer is extremely important for your exam. Extremely important. Diverticulitis and appendicitis. Pancreatitis, you have acute as well as chronic. Chronic is also very favorite topic of AMC. Cholecystitis, gallstones, and cholangitis. They can directly ask the cholangitis diagnosis as well. They love to ask about cholangitis. Then endocrinology, you have diabetes, every aspect of diabetes, yet how you're going to diagnose, how you're going to manage, what are the side effect of medications, how you're going to give the insulin in that patient, DKA, hyper osmolar state, that are very important for your exam. Then thyroid, thyroid is a part and parcel of endocrinology. So hypothyroid, hyperthyroid, thyroid storm, extremely important. Adrenal disorders and electrolyte metabolic disorders. Then neurology, you have stroke, you have seizures, you have headache, neurodegenerative disorders, and peripheral neuropathy. Go through the types of the GB syndrome as well. GB syndrome, every detail is important. Okay, so certain points you cannot miss. Whatever the topics I'm telling you, these are the high yield topics. That means you need to go in every depth of these topics. Okay, so go through the recalls, go through different MCQ pools, then you will be able to learn that among the topic which information you cannot miss. Okay, so these informations are extremely important for your exam. Renal, we have a very specific pool of topic like AKI, CKD, nephrotic nephritic syndrome, and the types of glomerulonephritis with which they love to ask. UTI, very important. Sometimes they just repeatedly ask the question that the asymptomatic patient who is an elderly patient who comes to you with a UTI, how you're going to manage the patient. This question, I think, I don't know why they love this question to ask. So remember, asymptomatic bacteriuria, you do not need to give any kind of treatment. You just observe that patient, especially in elderly patient. But there are certain indications in which you need to treat the asymptomatic UTI, like pregnancy, like the patient is undergoing any surgery, or the patient is having repeated infections. Then you need to treat the asymptomatic bacteriuria. Otherwise, you do not need to give any kind of treatment. So that's how the AMC just asks you any concept related to that topic. So go through the topic very thoroughly. And the recommended guideline for the medicine topics are basically your therapeutic guidelines. Okay, so therapeutic guidelines is giving you clear insight that what the topic is about, what focus should be on. So everything is so precise. Then renal stones, management of renal stones with respect to different size, with respect to different location, that is extremely important. Hematology, this is not very favorite topic of AMC, but still you need to learn about iron deficiency, B12, hemolytic anemia, DVT. DVT is a very high yield topic. Anticoagulants, they just twist the MCQs of anticoagulants. Then malignancy, myeloma, and lymphoma. Infectious, they love to ask about infections. Cellulitis, osteomyelitis, septic arthritis, infective endocarditis, HIV, and STI management. Then you have certain medication diseases that are directly related to travel. Let's say dengue and malaria. So you should be clear that which symptoms are pointing towards dengue and which symptoms are pointing towards malaria. And sometimes they mention some particular travel history as well. So travel history is also important to giving you insight that this area is endemic for certain diseases. So think about that diseases. Then vaccination schedule, and the last screening schedule, very important. Rheumatology, you have rheumatoid arthritis, osteoarthritis, gout, septic arthritis, ankylosing spondylitis, SLE, vasculitis, polymyalgia rheumatica, and giant cell arthritis. Dermatology, there are list of disorders of the dermatology, and in dermatology, remember, they can give you a picture as well. So we have guidelines which are dermnet. Okay, you can type dermnet on Google, and any topic of dermatology can be find on the dermnet. You can just go through the pictures, and exact same picture can come in exam. So very important topics, have a clear visual memory of that pictures as well. Then ops related topics are beautifully given on the essay hill. You have antenatal screening, gestational diabetes, hypertensive disorders, ectopic pregnancy, abruption, preeclampsia, eclampsia, shoulder dystocia, and your stages of labor plus CTG. You should know about the interpretation of CTG. You should know about the interpretation of ECG and very common X-rays and CT scan findings. Okay, they give you exact images in the exam also. So go through all these topics. Then postpartum mastitis. This is again a very favorite topic of AMC. Postnatal depression and postpartum mastitis. Gynecology, we have a list of topics that are given like uterine bleeding, fibroids, endometriosis, PCOS. Remember, PCOS has been updated. Now the name is PMOS, okay? Polymetabolic endocrine ovarian syndrome. That is not just polycystic ovarian syndrome. That has become PMOS now. So be updated with the updated guidelines as well. Then pediatric. All the pediatric topics are given in RCH. You have jaundice, sepsis, respiratory distress. These are the very important topics. Bronchiolitis, croup asthma, febrile seizures, gastroenteritis, otitis media, and the milestones. Okay, so these are important one. Psychiatry is a very high yield scoring topic of AMC. You need to remember psychiatry. Very few differences are there with respect to duration, with respect to symptom. Just correlate the things together, and the psychiatry will be so easy for you guys. So depression, bipolar, suicidal risk, extremely important. Okay, suicidal risk, they love to ask about this. Then schizophrenia, panic disorders, generalized anxiety disorder, obsessive compulsive disorder, and post traumatic stress disorder. Substance are very typical: alcohol withdrawal and opioid overdose. Then you have some high yield area regarding mental health act basis as well. And we have few surgery topics. These are some overlapping topics that will overlap with the medicine as well. But in surgery they love to ask about hernia, they love to ask about torsions, they love to ask about post prostate cancer. So you have to go through all these topics. And the public health ethics are very important. Sometimes they give you just 5 6 questions of ethics in a question in exam, and these are very you can say confusing questions. Sometimes they just need to see that are you able to assess the patient, are you able to escalate the situation. So you need to know what are the mandatory reporting conditions and what are the capacity assessment of the patient. Extremely important for AMC. So AMC wants you to be a safe doctor. They do not go into the so much details of the ethics. Just a safe doctor practice is important. And the public health, the screenings and indigenous health, aboriginals related guidelines, these are important one. These are must know presentation. You need to remember this can be taken as a shortcut or take home message, that chest pain, shortness of breath, abdominal pain, fever, altered mental status, syncope, vaginal bleeding, all the rash plus fever differentials, and elderly confusion related things. These are very important. And if I just sum up all the things together, so these are your priority: emergency medicine, cardio, OBS, peds, respiratory, endocrinology, psychiatry, neurology, surgery, and ethics. Do not miss any of the domain that can give you marks. Okay, so just go through electrolyte imbalance, just go through ECG interpretation, CTG interpretation, and how to manage first steps and what is the definitive management. Extremely important. If I go just give you a 2 to 3 week revision priorities at the end, like these are the topics you should not miss. Just go through all the flow charts, whatever are given in the RCH guidelines and the SA Health guideline. Try to save the flow charts. Make a separate folders regarding peds and gynae, and try to just save that flow chart specifically to that domain, so that at the end of day you will not panic. You will have a good pool of you can say shortcuts or revision notes. You can just easily go through the algorithms, flowcharts, that will be very beneficial for you as a revision purpose. So any question regarding your preparation, you can find AMC Smart Pep on Telegram, on WhatsApp group. I have given the description, just links in the description box. So just like and subscribe the channel and be updated with the different guidelines. If you want me to cover any specific topic, any specific unit, or any specific domain regarding MCQs or in-depth topic review, just write in the comment section and I'll go through your comments. I love to go through your comments, and that's how we can help each other. Okay, so that's all for today. Hope you find it beneficial. Any question, any particular query, you are welcome to ask. So I am Dr. Ushna by the AMC Smart Prep. Thank you so much.